is okay now. ISQua, I would like to welcome you all to this webinar. Our speaker today is Barbara Farlow, who is the World Health Organization Patient Safety Champion, and over many years has been involved with many patient groups in Canada and the US. Today, Barbara will be talking about engaging and empowering patients for better outcomes. The seminar will take approximately 25 minutes and we'll have additional 20 minutes left for some of your questions. You can ask questions by typing them in or raising your hand. Since we have over 120 people registered for this seminar, there may be a possibility that you might not get an opportunity to ask a question, but don't worry, we're going to open a forum afterwards, and Barbara will answer any unanswered questions then. Also, over the next few days, we will open a resource library with some journal papers relevant to Barbara's webinar. So on behalf of ISQua, once again, apologies. I hope you enjoy the session. Barbara, over to you.
Thank you.
Thank you.
I'm really sorry about the delays. Joe, I have an echo. Can you turn my thing on? Hello? Okay, that's good. Again, I'm really sorry for the delay, and thank you all for your patience. So it's a real pleasure for me to give a patient perspective to engagement and empowerment. And I want to start, first of all, by thanking ISQua. That team really, truly recognizes the requirement for the patient voice in healthcare. And so if not for them, this wouldn't be occurring, and they've given voice to me and to the various groups that I'm involved in. So thank you very much. Joe, I'm trying to advance the slide. Last year in 2012, over 400 health leaders, ministers, policymakers all joined together at the Global Health Policy Summit. And one of the emerging themes there that really hits home with the presentation today was this one: patients must come off the sidelines and onto the pitch. And I think that that's something that really represents the future in healthcare. We need to become involved, and we need the doors open for us to become involved. Could you advance? So let's start by talking about why we should engage and empower patients. We know that engaged and empowered patients experience a safer and higher quality healthcare experience. That's been proven in a number of studies. A patient who's engaged is more likely to be compliant in their care, and therefore there'll be better outcomes. Also, they feel more connected to their provider, and there's just a better quality in that experience. Everybody's talking about the fiscal pressure on the medical system right now. Not only are the costs of care rising, but the demand for care is also rising. And many governments and insurers are connecting payments to safety and quality. So healthcare systems, at the same time of facing all of these increasing demands and pressures, are also facing that they must maintain and improve safety and quality. Patients are a free resource, so they must be enabled as much as possible to achieve the goals. The harm rates are unacceptable. There's been some wonderful advances by providers over the last 12 years, 13 years since the To Err is Human paper by the Institute of Medicine gave us insight into the harm that's occurring. And so many great people have done amazing things, but when we look at the rates of harm, the rates are still unacceptable. And so many of them relate to communication. And when you reflect on the errors, you can see that could the patient have done something, communicated better with their provider, double-checked things? Could they in some way have made a difference in the bad outcome? And very often the answer is yes. We can't deny that the patient cares more about the outcome than anybody else because it's about him or her or about their family member. They know their own journey from start to finish in a way that nobody else will, and that enables them to be somebody that can teach and can give insight. And also, when you think about it, when you think of the healthcare team for a patient, surely they must be on the team because there's nobody more expert about themselves than they are. Could you switch, please? So the barriers to engagement, it's not that easy. The first thing is the attitudes of providers. Studies have shown that when patients are reluctant to contribute, it's because they sense that there'll be a negative response by the providers. So in what the provider says or does, or their sort of implicit actions, really opens the door to patients being empowered or not. One little example here that I love is a doctor I know, when she meets new patients, she's a neonatologist, the first thing she says to parents is, you have a job to do here. Your job is to make sure that everybody that comes in this room washes their hands. And if they don't, I want you to tell them that I said so. They have to do it. And I can't think of better empowerment than that. The other thing is lack of awareness of safety risks. And this is something as a patient that I found really quite interesting. The average person walking in the streets has no idea of the harm that occurs and the risk of harm that occurs, and I didn't at one time either. Yet it's very evident that it does exist. When we look at the publications and the studies are done, we know that it exists. And I think that in order to for patients to be motivated and to want to get involved, they must be aware of those risks. I've found that providers tend to be reluctant to share those risks, often because they don't want to scare the patient. And although there's no benefit in scaring somebody about something that they can do nothing to alleviate, sometimes they can. So when the patient can exhibit a behavior that will help them to be safer, I think it seems right that they should know about the risks. A study was done recently regarding blood transfusion safety, and what they found, that area is wrought with potential for risk and harm. And so they questioned both the providers and the patients about their willingness to be involved in things like making sure that they are the right patient for that particular transfusion and other areas. And what they found was that, yes, both providers and patients are willing to get involved. When they know the harm, they're willing to do those double checks together. So that's a really good sign. I mean, all of these things are quite cutting edge. What we're learning right now about patient involvement in their own care, the studies are really just beginning. So this gives us hope. The other thing is that they think that nobody cares what they say or what they contribute, then they're less likely to contribute, and that makes sense too. Sometimes a patient just doesn't have enough medical knowledge or confidence in the medical knowledge that they do have to want to contribute or to share. A big one also is that there's patients fear if they speak up, it might impact on their care. They are very mindful of being respectful, and that's why the hand hygiene programs that try to compel patients to ask their providers to wash their hands have not been largely successful. It's very, very difficult to ask a doctor who's involved in your care and perhaps your life rests in his hands to say when he comes in the door, did you wash your hands? That's very, very difficult for people to do that. The other thing is that sometimes people don't know really how they can participate in their own care. So that's another thing that we need to explore and find ways to empower patients. Next slide, please. So I'm going to talk about the tools and the ways to engage and empower patients, starting with sort of in the bigger picture of, as opposed to individual patients. The World Health Organization, I guess it was about 7 years ago, started the Patient Safety Champions. And what they did was they empowered people in 52 countries. They had workshops and empowered people, mostly who had experienced harm or almost experienced harm, near miss. And they taught us about patient safety, about just culture. Well, we went through workshops, and then they said, okay, go out and tell your story. And Sir Liam Donaldson actually said to everybody that if without the patient story, statistics are just numbers, that it was the patient story that would really be the compelling force to change. Margaret Murphy leads the organization at the World Health Organization, and many people around the world know Margaret. She's spoken everywhere. I love the Irish woman. And she has a phrase that she says, we patients are the grit in the oyster that produces the pearl. And I love that. So what we do around the world is that we share our stories. Many people sit on committees. Ultimately, we impact policy directly or indirectly, and we affect change and improvement in healthcare. Next slide, please. Here's a picture of some of the workshops, so you can see people from all over the world. It's really quite amazing to be connected in this way through the World Health Organization. Next slide, please. Another way that hospitals can engage patients and help to be engaged with patients is by starting family advisory council, patient family advisory councils. These are an incredible tool for hospitals to stay engaged with their patients, because the people on the councils can act as a valuable resource, a sounding board. They can review materials for literacy for other patients and families. And they offer, there's wonderful training available, because I know many hospitals that say, well, I think we should do it, but we have no idea how to begin. How do we start to engage even the first patient to be on one of these committees? So here's just one, Patient Family-Centered Care Partners, but there are other organizations that really go hand in hand with hospitals to assist them to begin having a patient and family advisory council. Next slide, please. So now to look at individuals and how they can become engaged and empowered. One really wonderful project, and surely it's the way of the future, is the Open Note project. And it's primary care, but they've made medical records available to the patients, 14,000 patients, so this is a very large study. And just one of the small benefits is that there's a 78% increase in adherence to medication, to their medications or the medical protocol that patients are placed on. Patients really appreciate sharing the records with the doctors, and it also allows them to ensure that their voice has been heard, what they told the doctor has been duly recorded and the doctor has heard. And it's just, we see this in many hospitals here where I am in Canada, that they're starting to have this kind of process where patients can access their own records and in a continuous manner. At first, the doctors were very fearful that this would take a lot of time and be very troublesome for them, but in fact, that has not proven to be the case through this study. So, so this is a great stuff for the future. Next slide, please. This is just one simple tool that's now in use in many hospitals. It's a whiteboard in the patient room for communication. And what they found was that often patients had no idea really of the very basics of their care, such as when they were going to be going home, who their nurse was, who their doctor was. People were coming and going all the time. So this is one tool that's there for everybody to see, both patients and their families and the providers, and puts everybody on the same basic page about plan of care, goal. Sometimes here in this one we see that the patient can express what kind of day they're having, so everybody that enters the room knows that. Next slide, please. Another area that has found to be fraught with potential harm and miscommunication is the handovers. Whether a patient is being admitted, discharged, or there's a change in rounds with providers, this has been problematic. So now we're starting to see that if you include the patient or their family and they can listen to what's being told from one provider to the next, they can be another set of ears to speak up and to say, oh, excuse me, I think you forgot that my mother's on heart medication, or whatever the case may be. Next slide, please. This is an exciting initiative called Condition H, and it's for patients and caregivers. When a patient is on the ward and they seem to be failing, or there's a problem, it may be that the nurse is not really sure, that maybe somebody, a new set of eyes, or it could be that the patient or family member feels that the nurse is not being sufficiently attentive to what they think is a crisis. They have the ability to call for help, and very often this is in the form of a team that will come and evaluate the patient with fresh eyes. And studies have shown that this has been effective. They've saved lives this way, but more than that, initially the thought was, well, people will be misusing it. People will be crying wolf, if you like, and calling all the time, and it'll be a real problem. And you know, they found that that has not been the case, that there have been really very few incidents of misuse. So, and somebody told me anecdotally that when this system is up and running, typically there is a different response from nurses on a ward to patient concerns. So it seems to have changed sometimes the behavior. So this has been a great program for patients. Next slide, please. Other tools and ways to engage patients. Studies have shown that when they show patients videos about things like how to contribute to safety regarding hand hygiene, how to interact with providers to ask them to wash their hands or to ensure the hygiene of their care, they've been very effective, significantly effective in some studies. So this is really just the tip of the iceberg. Videos are capable of teaching patients a lot of things, and they don't take up a lot of time on the provider's part. So this is one incredible tool that we have. Sorry, could you go back, please? Educational materials. Massachusetts legislated the requirement for hospitals to have patient-family advisory councils, and then they did a review on what were the pressing topics that were discussed within these groups. And the #1 issue by far was that the patients on the councils wanted educational materials. They wanted to know more about the procedures or the care that they were receiving, and they also wanted to know about the associated risks, and that's important too. So educational materials in a timely manner, perhaps before a person enters hospital, that's a great time. Patients are motivated to learn. They're perhaps nervous about their procedure. They can read. They can self-educate, and this is one great way to start the engagement before hospital admission. Also, shared decision-making certainly is the way of the future, and anybody who hasn't seen the video by e-patient Dave Bronkart really must, and that's included in my resources on the last slides. Basically what we have here is that patients you generally receive a diagnosis, they go online, they join patient groups, they become empowered through the information that they learn, and they become a partner with their doctor in their care. A framework right now by Dr. Provenost and others is actually being developed on how to enact this shared decision-making for physicians and patients. Next slide, please. So now I want to share with you some of the things that our patients that I'm aware of that are part of our global network, or just advocates in their own right and involved in various groups. There's thousands of them around the world. This is just really a glimpse of the kinds of things that they've been doing. And I have to apologize that there are so many that I should be telling you about, but we'd be here all day. So there's some people that I owe apologies to that I'm not including just for time. And the other thing that I have to say right here at the onset too is it's important to recognize the providers who have partnered with patients. When I look at the things that these people have done and my own involvement, if not for the courage of some providers who stepped up and said, you know, I'm going to listen to this patient or this family member, and I'm going to work with them, and they've been a partner in enabling us to affect the changes that we have. So that's important to recognize. Next slide, please. I'll start with Sue Sheridan. Many people know her story, and that's included as a video at the end as well if you don't. Sue's story is incredibly inspiring, especially to people who are new in advocacy, people who have experienced harm and say, well, I really think that this isn't right. I want to contribute. I want to make a difference in healthcare. Sue, along with 8 very determined moms, got together, and as Sue said, we wrote a plan on the back of a napkin after a weekend of hotel, and Sue always adds that there was a lot of wine involved in that experience. But they are just incredibly motivated mothers whose children suffered permanent physical disability because newborn jaundice was not detected in time. And they partnered with researchers, with administrators, with insurers, just in incredible fashion. They were blind to the silos that exist and the protocols that normally occur in healthcare. For instance, well, research takes a couple of years. They didn't know about that, and they were having none of that. They wanted fast change, and that's what they achieved. And now newborn testing for jaundice occurs in, I believe, all across Canada, most of the United States, and likely in most places in Europe as well. So these moms were very effective. It's an incredible story. Next slide, please. I like this little contribution. This is one of our members in Egypt. Magwa Matwali raised incredible amount of money, I think $600,000 US or something in that order, because her hospital needed new operating rooms, and I guess she had the means to help to do fundraising, and but she withheld the funds. She wouldn't give them over until the surgeons pledged to use the safe surgery checklist and to practice safe infection control. And she adds in her story that this was no easy task. So this is a good example of the grit and the pearl that produces the oyster. So it's a wonderful story. Next, please. Several patients who've experienced harm and reflected on what occurred and what they could have done had they known have written wonderful books. And this is an example of patients empowering other patients. And these books are easy to read, easy to follow, and help to guide a patient to protect themselves while in hospital or involved in care from experienced harm where possible. One book just consists of really short, easy checklists, and it's a great idea because, of course, the medical system uses checklists as well. So I think that we'll see more of these kinds of things in the future, perhaps not always in the form of a book, but in the form of an app. I think we're going in that direction as well, an application for smartphones. The next slide, please. My own story, when my daughter received inappropriate medical care, she had a rare genetic condition, and I wanted to improve the communication that exists between physicians and parents who have these children because they were very misunderstood. And I met two very wonderful physicians who were also ethicists, and we decided that the patient's voice needed to be heard. The parents' perspective had never been known in the literature, and we undertook the largest study ever done, and our paper was published in Pediatrics. And it meant so much to the parents. They produced this poster here for the doctors. Our community has a voice. It was an incredible achievement for them to be heard, and they thanked the physicians. And Dr. Janvier, one of the doctors, cried when she saw the poster, and she said, "This is the most important and meaningful project I've ever done." And I think this is the way of the future. We look at many countries are now encouraging through the funding of research, patient involvement right at the outset, the development of the research and the way the research is carried out. And it enables research also to be disseminated quickly when patients are involved right at the start. They have an interest in using that research to improve care and sharing it with their own networks and making sure that change occurs quickly as a result. So this is another way of the future, is patient involvement in research. Yes, next slide, please. I think this story is important. Joanna Trimble had an adverse experience with her mother-in-law. It was a medication reaction, and her mother-in-law was impaired cognitively as a result temporarily. And it was very, very simple for everybody to say, well, she's elderly and she has dementia, so this is what happens. But Joanna and her husband persisted that their mother did not have dementia. Something was wrong, and it happened when the medication began. And it took a lot of courage for them to speak up. Joanna and her husband is actually a mediator, and they speak about the courage it took to have a meeting with providers and express their views in a respectful manner, and they were listened to. And now Joanna has teamed with a physician, and they give talks all over about seniors and medication reactions and how this is a really important area. So the next slide, please. Loretta Evans' son, a young man, tragically died. In retrospect, such a sad story, a young man losing his life. It was a case of one doctor stating that he was in charge but leaving for holidays, and then believing that somebody else had taken over for him, but that change hadn't really occurred. So he was left without care, and the nurses all assuming one doctor, the other was involved, and nobody was. And so this tragic incident caused Loretta to persist and to get involved. She received an apology, and the hospital protocols changed to prevent reoccurrence. Now physicians have to sign on and sign off, so there's written record of who's overseeing patient care. So, and of course this idea would be shared with other hospitals. Next slide, please. Janine Thomas, when she tells her story, she always says, well, they infected the wrong patient. When she went for simple, I think it was ankle surgery, she developed MRSA infection and almost died, and it just, I guess it just irked her so much, as it should, that she had this infection and that there could have been steps to have prevented it. And she's been a tireless worker. She created legislation in her own state and then eventually developed an international network of patients and providers coming together to reduce the chance of MRSA infection. So this is, again, a good example of a patient being a catalyst for change. Next slide, please. Sorrel King's story, another one that's well known. Sorrel lost her daughter, Josie, after fluid and medication errors subsequent to developing a central line infection. Her story is well known and been a tremendous catalyst for change. And she also donated funds for a Patient Safety Foundation to affect change. And one of the wonderful things about Sorrel's story is that the catalyst that she was caused a wonderful physician, Peter Provenance, to develop a central line infection checklist. And this was no easy task because he needed to change the hierarchy and improve the multidisciplinary nature of provider care in the implementation of the checklist. And Dr. Provenance says that the number of people whose lives are saved by the usage of the checklist is equivalent to the number of women who were dying for breast cancer every year. So this was really significant development. But more significantly was the way in which it's implemented, because it allows us to think outside the box of how we can improve care through a different way of providing care. It's not always the patient down to the the doctor down to the nurse down to the patient, but everybody needs to be involved and share concerns and duties. Next, please. Tanya Marin suffered a really, really tragic miscarriage with her daughter Sophia when she was 18 weeks gestation in the emergency room. And what she discovered was that there was a protocol existing in the hospital that said that patients who were miscarrying would only be allowed admitted to the ward if they were 20 weeks pregnant or further or beyond, and that was the reason that she was left in the ER, and the staff there really did not have the training or capabilities to care properly or compassionately for her. And Tanya persisted 2 years of effort, and she changed that policy. Also, the hospital created a memorial wall for her daughter and for other unborn babies who died. So she for people in her circumstance at that hospital. So it's wonderful work. Next slide, please. Peter Walsh founded a group that provides free support, and they have over 3,000 people a year. Sir Liam Donaldson did a video for this group to empower them and to support them, and it's just one example of involved and encouraging in this instrument as well. It's a great model. Next slide, please. The World Health Organization is collaborating on something called an M-Check tool, and this is really an incredible idea. In developing countries, often women who've just had babies are without the care that they need, and there are some various things that can cause morbidity or mortality of mother or newborn. And so this paper based some of these common areas where there could be problems. And then there was from there, their support is connected through a mobile device. A hospital nearby, patients can be empowered to care for their newborn and themselves and to reduce mortality. So this is now in the development phase by patients and for patients. So it's a great idea, maybe an idea where other countries can learn from. I mean, charged from hospital earlier. They need tools that enable them to care for themselves and to know the warning signs. Next slide, please. Helen Haskell's son tragically bled to death from a medication reaction following elective surgery. Everyone over a span of 14 hours, or actually, sorry, no, it was 30 hours, missed the signs of perils. And Helen and her husband continuing to call for the attending physician, for higher up people, and people having a response of there's nothing to worry about, everybody's in charge. And Helen started a group called Mothers Against Medical Errors, and that's just one of the many things she's done. Helen is recognized as one of the most influential people in American healthcare, and that's really quite an accomplishment for a mother. And she's also a very wonderful friend to advocates around the world and supports them. And one of the things I also want to say about Helen, Helen was not in the medical system at all, and after her son died, she took her own money and she paid for a conference on rapid response systems and got up her courage, and at the very end went to the microphones and turned to all of the providers there and said to them, "I'm the reason you're all here." And she told her story, and they embraced her, and she's a speaker at every one of their conferences. So it's a great example of engagement. Next slide, please. So this is just a small sampling. Patients and families are capable and they're motivated, and we really need to look to the future of engaging and empowering, because we can make a better and safer system for all of us. And thank you so much for your patience, for listening, and again, apologies for the delay. Joe, we were going to have a poll about who's listening in today. Can you activate that, please?
Can you activate that, please? Certainly. It's activated now, Barbara. Barbara, thank you so much for this very interesting presentation. We have a question from Paul Ireland. What's our shared vision for patients' engagement in 10 years' time?
That's an excellent question, and I can only provide the vision that I would have. And I think that other people can contribute. In fact, this would be a great question on a forum, and I think, Joe, you can set that up for everybody to contribute if they'd like. What I see myself, I'm concerned about the challenges to the system and the fact that perhaps things like nursing ratios will change. Patients will be discharged from hospital sooner. And the risks that are inherent in these events. So what I'd really like to see is more empowerment and tools that enable patients to be empowered. When you look at human factors and the capabilities of technology to instruct and to keep patients safe, sky is the limit. It's really quite incredible. So I think we're going to see a lot of development there, and I'd really like to see that the use of some of this technology perhaps frees up time to enable doctors and patients to talk more and listen more. I think that's really important. When the education of parents can be done through various tools, then maybe there can be more shared discussion about plan of care as opposed to just what the condition is. So it would be great to hear from many people on this about the future of patient engagement and empowerment. Joe, did you have another question?
Yes, we do have we actually have the results of the poll. You were asking about the type category that people belong to, and we have 28% of patients, 28% providers, 36% administrators, and 8% of students.
Oh, that's excellent. That's very good, and thank you for everybody for listening. I had a joke that I hope there were more people besides my family members here. So I see that that's the case, and thank you very much for listening in. It's wonderful that we have such a myth. Obviously, is a collaborative initiative.
Great. We have a question from Hashim Sadhu. I am touched by the stories and actions that people have taken for patient safety. Is there anything that is available or has been done in any developing country with poor healthcare systems?
Thank you for that question. That's an excellent question. Yes, there are, through the World Health Organization, they're very active in these countries, and if there isn't a workshop or a patient involved in a particular country, they can be connected to them. So there is a lot of work in that area. Important, I think, because of the need for patients to become empowered in their own health care when access to care might be more limited. So absolutely, anybody can get involved and can contact Margaret Murphy at the World Health Organization, World Alliance for Patient Safety, and get involved. We welcome that.
Great. There is another question from Dina Barudi. Thank you very much for the excellent presentation. How do you think that we can start changing the culture of patients to let them be engaged in my part of the world, in Saudi Arabia? Patients really is too passive to be engaged.
Passive patients, that's very interesting. You know, I think the most important thing to get patients to step up to the plate, in addition to having providers who welcome that, is for them to become aware of the risks of harm that occur. And there are numerous publications. I'm not aware that there's been a adverse event study done in Saudi Arabia, but what we see from all of the other countries that have undertaken these studies is the rate of harm that occurs. So it really is, it's everywhere. And it's important to state that we know that much of this harm is not related to poorly trained nurses and physicians, but it's just the complex nature of healthcare. There's so much technical equipment, there's blood tests, there's communication, there's so many patients, and it's just the very nature that human error occurs a lot. And we do what we can to alleviate it, but I think when patients hear about these things, then I think that they're going to step up to the plate. They're going to be more likely to say, hey, wait a second, I want to get involved. So that partly is the providers engaging them and letting them know about the risks, which is another barrier, another challenge.
Thank you, Barbara. We still have many questions flowing, but perhaps we only have time for 2 questions. So the first one is, did I understood you well that health literacy is very important? Do you have suggestions or programs to improve health literacy? Jan Vasur asked that question.
Thank you for that question. Oh, health literacy is everything. And I think this is an area, especially where technology, whether it's the use of smartphones, videos, that we can use to ensure safety. And this is also an area, I think, where collaborations with patients is critical. Just as one personal example, my daughter had knee surgery, and I was there, and I thought, okay, I'm really aware of patient safety here. I'm going to do a really good job of taking care of her. And I failed her miserably. And what happened was they gave me, as we were leaving the outpatient, it was morning surgery, as we were leaving, they gave me a sheet, a fine small print, double-sided, single-spaced instructions on her care that I was supposed to read. Well, when we got home, there were so many things to do. I had to get the cooler with the ice going and have it wrapped around her knee and get all that figured out. And we were very busy with that. And meantime, she started to experience pain. So let's hurry get the medication going for that. Well, it was afternoon. Oh, then she started to vomit. And so, of course, that kept me even busier. And it was in the middle of the afternoon before I finally read this sheet that really was difficult to read. And one of the first things I read was that you should never give medication on an empty stomach or the patient will vomit. So I caused harm to my daughter, and when I reflected back, I thought, how difficult could it have been for the providers to have given us this information in a little bit more aesthetically pleasing way to read before the surgery? We could have gone through it together and prepared. or perhaps while I was waiting for her, I could have read it but was not given that information. So very, very simple things we can do to improve health literacy and care. Videos are another way, to show patients what it looks like if something is infected. When you just describe, oh, the wound might be red, you can show pictures, you can show videos, and you can make it even fun and simple. So there's just, so many ideas. And again, we have to collaborate with patients to see how they interpret this information.
Wonderful, thank you. Another question from Shady Botros. Barbara, thank you for a great presentation. As a medical provider, I would like to know, if you were admitted as a patient, what should you do, should we do on our part to get you involved in your care?
Well, I have my wish list. It's interesting when you know about the potential harm, how you would behave differently if you were admitted to hospital. I think that patients need, first of all, infections. They not only to remind providers to wash hands, but for themselves as well, to ensure that they wash their hands and their visitors wash their hands. That's another area. But I think they should be empowered to know that at any time they like, they can ask the nurse where the special wipes are, and they can wipe down the IV pole, the door handles, the bed rails, so they can ensure their own reduction in risk of infection. I think that's important. Also, patients need to ask questions. They need to speak more. And anybody who's been a provider in hospitals always tells stories about how they realized how scary it really was, and how they've been singing a different tune as an administrator or a doctor, but yeah, speak up, speak up. But when they're in the bed and they're concerned about their own life, how difficult, how scary it is, and how you just want to say and do whatever you need to get the very, very best care from your provider. And you don't always want to ask questions or to challenge information, and yet this is really what we need to do. So I think it's important to instruct patients. How is it that you should how interact with your provider? How do you ask questions? And it's just a way of teaching them and empowering them. And of course, also teaching doctors that to allow for this to happen. So I think that's important. One other thing, most of the advocates would say if somebody's in hospital, especially if they're not able to speak for themselves, perhaps a child or somebody who's very unwell, that there should always be an advocate, family member, bedside, 24 hours around the clock to be a voice for that patient. So that's another thing. And I think when I speak to providers, they're very, very reluctant to share the risks or to suggest that somebody be bedside, because they say they don't want to frighten the patients, or they what if a patient had nobody beside them? The thing is that if somebody is there anyway, they could be empowered to know what to watch for and to help to ensure the safety of that person. And I guess I would say to the providers, what if it was your family member in the hospital? Would you, and they couldn't speak for themselves, would you leave them alone, or would you stay by their side? And whatever it would be that you would do for your own family, it's only right that and fair that patients have a chance to do the same for their own when they're aware of the risks.
It's great. Now we have just one comment from Nikita Prasopha-Blazier, who said, congratulations, well done, Barbara. For more info, perhaps you can suggest people to visit PFPS webpage. And also, just very last question from Mercedes Lorenza. Hi, before my question, I would like to thank Barbara for all the information provided. I would like to know what her opinion is about the use of surveys as a tool for involving patients and empowering them.
That's a really good question, and it's a great way to get started. What I would suggest is that when they develop a survey, that they develop a survey with some patients. Sometimes the way providers see things and perhaps would pose questions would not be the way that the patients would. And I know in the research that I did, I developed the survey with the doctors, and it was really a very interesting experience. Sometimes I think that patients are like a mirror. Providers can think they know how it works from start to finish, or how the care is delivered. But a patient is a mirror. When you ask them, what does it look like? It's like looking in a mirror. And sometimes it's surprising that what you think you're doing isn't really exactly the way the patient interprets it. So I think that surveys are an excellent way to begin and to understand the patient population of a given hospital or physician service. But I would strongly recommend that the survey be developed with patients.
Wonderful, Barbara. Thank you so much. And thank you on behalf of all the attendees of this webinar as well as ISQua. Thank you for presenting this engaging presentation to us today. And we're going to open a forum over the next couple of days, and we will also have a recording of this presentation and the PowerPoint slides available to everyone. So Barbara, thank you very much.
Thank you, and thank you to everybody who joined us today.